Hey guys, Don here. I want to talk a little bit today about something that I don't think a lot of us are comfortable doing or even doing in our office, and that's called packaging of what we offer to patients. And I came across this because actually I was listening to a podcast from another gentleman about the car industry, and I think you'll all kind of equate to this. When you go buy a car, they don't ask if you want every single thing. You don't want, electronic windows, and you want heated seats and things like that. But basically, they have these basic plans, and then more like the advanced plans, and then you have this really pimped out ride. Okay, that's what they do for the cars. And one thing that I find kind of challenging, and that I have been finding challenging in my practice, is offering packages. Now, why? Well, as I've talked about before, I tend to use something I call patient presentations, and if you want to learn about it, it's going to be in the membership, in our members package there. You get to try it for a month and see if you like it, and you'll have the whole course on patient presentations in there. And part of the patient presentation is something called a checklist. So basically, when I see patients, I go through kind of what they have, why they have it, and then I'll go into this checklist. And this checklist has like 20 things on it, because if you think about plantar fasciitis, there's tons of ways to treat plantar fasciitis. And for patients, it gets a little bit overwhelming. So what I'm trying to do now is I'm trying to package things. Basically, these are the things that if you want, for example, only insurance. What insurance is going to cover is they're going to cover x-rays, they're going to cover a cortisone injection, and that's about it. And then you're going to ice and stretch. Okay, so that's the basic. Some patients, that's all they want. They want the basic. They haven't tried anything else. They don't want any of these other treatments. But during the course of sharing this with patients, some patients may want other things. And instead of offering, well, do you want to do orthotics, or do you want to do shockwave, or do you want to do, or you need shockwave, or you need orthotics, kind of doing it that way, I'm trying something else where I'm doing kind of a package. And what I'm going to talk about kind of like the car analogy. You can have the pimped out ride, or you can just have the basic. And for me, in my practice, I don't know how your practice is, but the basic for me is going to be shockwave, which is the way of reducing kind of the inflammation and repairing it. And then you'll also have orthotics. Okay, so when I talk about plantar fasciitis, I'm not sure how you guys do it, but I talk about reducing the inflammation, and I usually recommend the shockwave to do that. And then you also want to help stabilize the foot and reduce the stress and strain through it. And that's where I usually recommend an orthotic. And then third is like reducing the tightness in the calf. And then I'll use like foam rolling, and then I'll also send them for physical therapy. So that initial package is going to be shockwave, orthotics, and like foam rolling. Okay. And then I just picked a price for that. Let's say it's going to be $1,200. Right? And so what that includes is the 4 treatments of shockwave. They're at $150 a piece. And then we do both focused and radial. And then what I do is the orthotics are $550. And then like the foam rolling, I think, is $50. And I might give them a bonus of like let's say a course that I put together on plantar fasciitis, or the book on plantar fasciitis, or something like that. So basically, I'll offer that as one tier. And then the other tier is going to be like the pimped out ride that we talked about before. And what the pimped out ride would be some patients, they just want to do everything that they can do, and they don't want to do a stepwise approach. The more steps you do, the longer it takes people to get better. That's what I found. In most people, it takes about 3 months if they've had it for 3 months with a plantar fasciitis. And so the pimped out ride is going to be shockwave plus amnio, right, with an ultrasound. And then in terms of the orthotics, maybe we'll throw in 2 pairs of orthotics. We'll do like a dress pair of orthotics and a regular orthotic. And then maybe we'll give them I'm just throwing things out here because I'm still working on it. We'll give them a voucher to a shoe store to get a pair of shoes and a pair of UFOs. And then package all that together for maybe $3,000 or $4,000. This isn't something that I've done in the past, and I know I've been kind of hesitant to do it. I'm still learning. So I basically, as I go and test this on patients, I'll let you guys know how it goes. But basically, the idea is packaging of things together. If you guys have any experience, I'd love to hear your thoughts. You can send me a message here on this podcast. Send me a voice message. And also, I want to invite you guys to the next group session, and that'll be in the month of March. And that group session, we're going to talk about plantar fasciitis. And within this plantar fasciitis, you're going to see my kind of protocol and then how I'm including or practicing with these packages and see how they work. You can go to Podiatry Practice Mastery and you can sign up in the membership part, and then we'll send out the invitation to that, send you the link. We're going to be doing that online, and you can also have access to it afterwards. Okay, great guys. Have a great day. Thanks.